I'm Dr. Thomas Coon. I'm the founder and director of Coon Joint Replacement Institute in St. Helena, California. And I'm currently consulting, teaching, and training in robotics for Stryker Mako Robotics throughout the Asia-Pacific region. You know, I've been practicing orthopedic surgery for 35 years, and the changes have been dramatic. Really very few of the procedures I was originally trained to do 35 years ago are still performed today. The greatest changes have been in the area of knee and hip surgery with the addition of robotics, new materials that allow us to have longer lasting joints and improved function for the patient. Well, knee surgery is critical only if you want to walk, and most of us do. So I think most adults during their life at some time will have some sort of knee problem. A large number of adults are afflicted with quite severe arthritis of the knee, and the procedures that we've developed have really helped to make that much better and to prolong life and the perception of health. Surgical intervention is planned based on the individual patient need. Typically we start with a non-surgical approach, including medications, possibly injections. Then we would proceed to a relatively more minor procedure, such as arthroscopic procedure to clean up damaged joint surfaces. Once the joint is totally destroyed, then we would proceed on to partial or total joint replacement. You know, I've spent my whole career really trying to make the procedures better and to allow patients to get better more quickly. I've developed a number of different procedures and devices to help improve that process. In my opinion, there have been two major evolutionary changes in the knee replacement world in the past 15 years. The first being the adoption of minimally invasive surgery, which I'm credited with inventing, and the second being robotics, which I'm also a part of the pioneering group and design surgeon for that process. And very pleased that those results have been very good for patients. I think the biggest changes in healthcare, particularly in the world of knee replacement, have been the introduction of minimally invasive surgery, followed by its combination with robotics and computer guidance, which allows us to do a much more accurate job in reproducing normal knee kinematics. You know, it's a very interesting question. I personally believe that the biggest advantage of the Mako system over navigation is that, number one, we're using three-dimensional planning with Mako, since it's based on CT scan. It allows us to better reproduce the normal anatomy. And secondly, we're not just navigating cutting block or an alignment tool, we're actually navigating the tip of the cutting instrument. It allows us to do a much better and much more accurate job with our bone cuts. The development of implant and product lines is really a collaborative effort between engineers, surgeons, marketing planners. We as surgeons outline problems, and we bring those to our colleagues at the company, and they need to make a business plan or marketing decision as to whether that's a valuable product for the future of their company. You know, really, for me, the focus has always been on patients. I feel like if you take care of the patients, they will take care of you. Certainly, we try to make products as surgeon-friendly as possible. We want to make the surgeon's life more straightforward, easier, allow them to do a better job with lower stress. It's a combination of both surgeon and patient factors. I'm here in India to help train surgeons, to help introduce the robotic platform to India, and I've already engaged in training several surgeons, and we'll be doing more in the future. I have been using the Mako robotic system for partial knee replacement since 2006, and for the total knee for nearly 4 years now. And I'm very happy to say that our patients are very happy, they're very satisfied with the procedure, much more so than they were with traditional knee replacement processes. And we're now getting early investigative data that's showing that patient satisfaction is statistically significantly better with the Makoplasty system.